Welcome back, everyone. For this lecture in the toxicology series, we're going to talk about stimulants and the stimulant toxidrome. Stimulants have various forms that can allow for absorption by ingestion, inhalation, or injection. And clinical presentation can include things like agitation, anxiousness, delirium, dilated pupils are common, difficulty sitting still, states of hyper-metabolic, profuse sweating, thin appearance, and track marks. One of the common stimulants that's used frequently and that we encounter in the pre-hospital world is cocaine, and this is an alkaloid that's extracted from ethoxylene cocoa. The pathophysiology is that it's a local anesthetic and a nervous system stimulant, and it enhances the release and activity of neurotransmitters. Crack cocaine is when cocaine is mixed with baking soda and water, and then it's cooked or baked. Typically, users of cocaine will feel the effects in 1 to 3 minutes if it's snorted and within 8 to 10 seconds if it's smoked as crack. When the effects wear off, the user can experience a crash and oftentimes seeks a re-up or a re-bump or a redosing of that medication. In an attempt to avoid crashes, it leads to polypharmacy and additional consumption of medications and substances. An assessment for cocaine users, some of the common symptoms that we may see are things like chest pain, shortness of breath, diaphoresis, and psychosis. Important note for the paramedic providers is that we can see some cocaine-induced cardiac dysrhythmias, and it's not uncommon for when we do respond to a user of medication. This is the reason we're called out, is for chest pain. So we can see things like cocaine-induced cardiovascular spasms, which create myocardial infarctions or ventricular dysrhythmias, and then sudden cardiac arrest. Amphetamines are things like methamphetamine, methylene dioxylamphetamine, and methylene dioxymethamphetamine, and they have a number of clinical applications, including things like nasal decongestants or prescription medication. Methamphetamine is a low-cost, long-acting stimulant, and it can last up to 12 hours, and ingredients are available locally. Restriction has increased in recent years for access to the ingredients for methamphetamine, and patient management is going to be the same for other stimulants such as cocaine. Bath salts are a substance that's related to a chemical compound derived from the cat plant, and it's engineered for higher potency. It can be ingested, insufflated, smoked, or injected, and the most serious side effects include paranoia, excessive strength, excited delirium, and hallucinations. As far as management for stimulant abuse concerns, we need to make sure that we're maintaining airway, breathing, and circulatory status. Oxygenation can become important for the hypoxic patient, and if you're an advanced level provider, IV access and fluid boluses may be warranted, and for paramedics, ECG monitoring is paramount for these patients. For paramedics, you may need to consider benzodiazepines for sort of a counteraction measure against the stimulants, and for violent behavior, you may need to consider chemical restraints. EMTs and paramedics need to manage hypotension with fluid infusions, and EMT basics may need to manage this as you would with others, with warmth, temperature control, transport, and oxygen for the hypoxic patient. For EMTs and paramedics, fluid resuscitation may be required, and paramedics should be assessing cardiac dysrhythmias, including conducting a 12-lead ECG. Treat chest pain just as you would for any acute coronary syndrome. A stimulant-induced MI is still an MI and should be treated as such. And then local protocols may allow for benzodiazepines for certain symptoms, or chemical restraint may be needed for these patients. Aggressive cooling may also be indicated for hyperthermia and signs of delirium or severe agitation. Throughout resuscitation, make sure that you maintain urine output with aggressive fluid therapy. You're going to need to hydrate these patients extensively, and so make sure that for your EMTs and paramedics, you're continuously giving fluid infusions to ensure that hyperthermic patient has adequate fluid supply. If the patient has a seizure, then your per certification level managements are going to be appropriate, and you may need to contact online medical control for additional options for anti-seizure medications for these patients.